Good afternoon, everyone.
Good afternoon, Miss.
So, we are going to discuss about suicide.
Suicide. Objectives: to educate, to be aware, and to prevent.
Suicide means ending your own life. It is sometimes a way for people to escape pain or suffering. When someone ends their own life, we say that they died by suicide. A suicide attempt means that someone tried to end their life but did not die. There are many reasons why a person might think about suicide. Most people who are suicidal have some type of mental condition or illness. They may have a chronic condition, which means that it has been going on for a long time. But it may be acute condition, which means that first symptoms of mental illness happen rather quickly. What can I do if I am thinking about suicide? Thinking about suicide is scary. You may have strong feelings that are hard to deal with. You may feel like things will never be better, but you're not alone. Many people think about suicide. Thinking about suicide does not mean that you will do it. It does not mean that you are going crazy. Thinking about suicide is often a sign that you want to escape. There are many ways to feel better. Remember, you are not alone. You can start by talking to someone else. You can talk to a family member or friend you trust. You can also call a crisis line. In BC, call 1,800 suicide. It stands for 1,800-784-2433. You can call this number whenever you need help. They are trained to help people.
Miss, ano yung mga causes and effect? Ano?
Here are the causes and effects of suicide. Major psychiatric illness, in particular, mood disorders, depression, bipolar disorder, and schizophrenia. Substance abuse, primarily the alcohol abuse. Family history of suicide. Long-term difficulties with relationships with friends and family. Losing hope or the will to live. Significant losses in a person's life, such as death of a loved one, loss of an important relationship, loss of employment or self-esteem. Bearable emotion or physical pain. If you have a doctor or counselor, tell them how you feel. They can teach you skills to deal with the thoughts of suicide. The warning signs and the risk factors of suicide. A person who is at risk of committing suicide usually shows signs, whether consciously or unconsciously, that something is wrong. Keep an eye out of signs of clinical depression, withdrawal from friends and family, sadness and hopelessness, lack of interest in previous activities or in what is going on around them. The physical changes, such as lack of energy, different sleep patterns, change in weight or appetite.
Unsay signs ug symptoms anang suicide?
Excessive sadness or moodiness. Long-lasting sadness, mood swings, and unexpected rage. Hopelessness. Feeling a deep sense of hopelessness about the future, with little expectation that circumstances can improve. The sleep problems. Sudden calmness. Suddenly becoming calm after a period of depression or moodiness can be a sign that a person has made decision to end their life. Also, the withdrawal. Choosing to be alone and avoiding friends or social activities are also possible of symptoms of depression. A leading cause of suicide, this includes the loss of interest or pleasure in activities the person previously enjoyed. And last, the changes in personality and or appearance. A person who is considering suicide might exhibit a change in attitude or behavior, such as speaking or moving with unusual speed or slowness. In addition, the person might suddenly become less concerned about their personal appearance. dangerous or self-harmful behavior. Potentially, dangerous behavior such as reckless driving, engaging in unsafe sex, and increased use of drugs and or alcohol might indicate that the person no longer values their life. And the dangerous or self-harmful behavior. The recent trauma or life crisis. A major life crisis might trigger a suicide attempt. Crises include the death of loved one or pet, divorce or breakup of a relationship, diagnosis of a major illness, and loss of a job or serious financial problems. Making preparation, often a person considering suicide will begin to put their personal business in order. This might include visiting friends and family members, giving away personal possessions, making a will, cleaning up the room or home. Some people will write a note before committing suicide, and some will buy a firearm or other means like poison. Threatening or talking about suicide. From 50% to 75% of those considering suicide will give someone, a friend or relative, a warning sign, of course. However, not everyone who is considering suicide will say so, and not everyone who threatens suicide will follow through with it. Every threat of suicide should be taken seriously.
Unsaon pag-prevent sa suicide unsay mga tips para makatabang to prevent suicide?
And here are the suicide prevention tips. Number 1. Speak up if you are worried. Number 2. Respond quickly in a crisis. Number 3. Offer help and support. To help a suicidal person, get a professional help. Follow up on treatment. Be proactive. Encourage positive lifestyle changes. Make a safety plan. Remove potential means of suicide. And continue your support over the long haul. Any questions or clarification regarding our topic?
Understandable naman, miss.